CCTV Lone Rashapi Daka Frank Motors Kajaka Dekali Gabatamai Junka Tata Motors Halatko Ni Shillong Rinkat Bakanet Foodish Ordar Mapi Ninwan Ramani Hakirdob Ying Jompi
Menteri Kakak Kakia James PK Sangma hakasngi palai ka arpun reuteri ujema arjar arpuar lapli pajba ya ka biological waste management system ka jaka sumari ke teman kemudian shipho Jingthiah belatib kum ka Geriatric ward bad ya ka PSA oxygen generation plan ha Shillong Civil Hospital yakni ke program la pelong hapelau jong hospital dak office jong joint director of health services civil hospital Shillong hakni sila sakilang da principal secretary jok nat ka koi kakya usampat kumar bat kiwi
Civil hospital has done extremely well during the COVID period. In fact, you have proven how actually a public sector hospital can do differently. This is something I'm not saying that just for the sake of saying. I have the data. We used to see how many patients were treated at civil hospital and at different hospitals, how many have been actually, have recovered and, done very well. Extra remarkable work is done by the civil hospital. I must congratulate, and this is the strength. I think this kind of a spirit we should continue. In fact, yesterday I had received one message from one district level of medical officer. She sent a message saying that we were quite, involved and motivated by the rescue mission. Every week we have this in-depth, review that happens. So they are taking so many actions. Things are happening. We are, and she's also giving suggestions that on the World Environment Day is coming up. We heard, a World Environment Week is going to be launched. In fact, by our honorable, health minister, who is also forest and environment minister. So what they said is that can we actually remove all the junk in the hospitals? So very good thing. We should remove. In fact, we are issuing those instructions. Remove every junk. We should make things hospitals more clean and we should not keep something which actually some instruments are not working for years and years, but we keep them there, and vehicles we keep them there. So it's a very important thing. So that spirit I've shared with one policy person, who's actually helping us in terms of getting best insights from at a national level and international level. They also have come here as well. Professor Sundar Raman he was the executive director of National Health Systems Resource Center. So for 7 years, and is a great person. So when he was, when we shared with the team, they said this contagious spirit is the key thing for any change in the state. So we need to have that positive spirit which is contagious from one doctor to another, one nurse to another, one healthcare worker to another. I think this is what we expect. We need that spirit. And I'm sure we have a good team. I'm seeing one Dr. Anisha sitting just like that, and she has taken so much motivation, very enthusiastic, and now today you see the cancer hospital is running, and it is running so well, and we are going to have the best care services offered by the civil hospital. It's a great time to celebrate, and I must, as I said, civil hospital has really done a fantastic job, and it's a time to celebrate. I thank everyone, the entire team of the doctors who are here.
I completely agree with what our Principal Secretary just mentioned about the kind of services that Civil Hospital is offering, the kind of achievements you've been able to achieve over the years, and this is really something that all of us in the department, especially me, we are very, very proud of, and really I would like to start off by saying that we really appreciate the kind of way that things are systematically organized here, the way that the doctors, the nurses, all the non-medical staff, everybody in Shillong Civil Hospital, kind of services they offer. It's not easy. I know how difficult it must be. It's being a doctor, being in the medical profession is one of the most stressful jobs. But yet, all of you are offering this yeoman service, which is really very commendable. And thank you to each and every one of you, and congratulations for the kind of achievements that you've been able to achieve. And today we are not inaugurating just one but three such interventions. COVID has been a rude awakening for everyone, but nonetheless an awakening, and it has made us sit up and look at very, very small things which we would have on our day-to-day lives missed out, like the PSA oxygen plant. And I'm happy that today Meghalaya as a state is extremely self-sufficient when it comes to oxygen supply in our medical facilities. And this plant is being inaugurated. It's just a formality. It has started functioning a long time back, and it has been functioning very successfully. And kudos to the medical staff.